Welcome to the Medical Minute podcast. I'm Anne Connell, a Melbourne-based GP and skin cancer doctor.
And I'm Moz Calafella, also a Melbourne-based GP and skin cancer doctor. For those who know us in real life and follow us on the socials, they'll probably be aware that the clinic that we work at in Briar Hill, Yarra Trail Medical, has just announced that they've invested in a state-of-the-art, completely whiz-bang 3D total body photography scanning device called the SkinCheck 360 at our clinic, where the brand name or the marketing name from the group that uses it is the Vectra 360, which is absolutely amazing news for the patients in the area and the local community. But it has meant that both Dr. Anne and I have had our inboxes, our socials, and in real life sort of flooded with questions around what is the Vectra 360? Why would anyone bother doing it? Is it better than doing something else? Should everybody get a total body photography scan? And so we thought we'd spend a little bit of time answering some of those questions today. Is that right, Dr. Anne?
That's right. Just a wee bit of time explaining what total body photography is, what it offers over and above a top-to-toe manual skin check, and what's particularly special about the whiz-bang machine that Yarra Trail Medical has purchased and will have going, I think, from early May. Is that correct?
Yeah, I think early May is I think bookings are open. Bookings will probably already be open by the time this podcast releases, because I think they're coming up probably the next day or two after we record. But I think it will actually go live in early May. That's right.
Yeah. So before we go any further, I remind everyone that, as usual, podcast is education and hopefully entertainment, but not individual healthcare advice.
Absolutely. So what is the difference between total body photography and just doing a normal skin check? Can it replace a full skin check if you go stand in front of some sort of camera and get some photos of your body? Is that good enough? Do you need a human being?
You absolutely do need a human being. It is definitely not a standalone skin check, and that's been one of the points of confusion. It is an amazing machine, but it can't actually diagnose skin cancers, and it can't make management decisions. So for the foreseeable future, you will still need an Anne or a Moz to help you with that bit.
But Dr. Anne, it says it has AI. So doesn't AI, replace everything in humanity these days?
Oh, patience, Dr. Moz. We'll work through it step by step. It does indeed have artificial intelligence, and that artificial intelligence is really helpful to us because it speeds up the things that machines do well, which is counting and measuring, the things that would take a human being a long time to do. But anyway, back to basics. Why on earth would anyone think about having total body photography?
So I guess total body photography at its core, if you don't understand what we're talking about, is standing in a particular series of poses, or where this machine has you in a single pose, and getting some photos of your entire skin as much as we can take photos of it. And the main value in the total body photography is actually usually not going to be in the first time that you do it, is it, Dr. Anne? So
no. The first time is actually just your baseline, and it will be on your second and subsequent occasions of having total body photography that you can see why it's clever and useful. And the reason is that almost all, 80% of melanomas are a new spot. Yeah. So when you compare the first set of pictures with the second set of pictures, if there are new spots, then they're immediately of interest to us. Yeah.
Mm-hmm. Yeah, absolutely. And so I guess, the reality is this thing's going to start to shine probably next year and the year after, where people who have had really high quality total body photography this year, when we see them next year for their skin checks, the quality of the total body photography will assist in making decisions around whether spots are new or not, because total body photography as a concept is not new. But this thing is going to have exceedingly reliable total body photography, and I think we'll talk a little bit more about that at a later stage. But it's really about being able to reliably pick up change.
Yeah, so it will pick up new spots, and it will be able to tell us the spots are changing in size, changing in colour. And melanomas will almost always be a new spot, but if they're not a new spot, they'll be a changing spot. So Not every new spot or changing spot will be a melanoma, but if you have, say, 300 or 400 spots on your body, it's really helpful if the total body photography, in association with its inbuilt artificial intelligence, can say to us, hey, these 15 spots are of interest because they are new or have changed. They're sort of waving to us from a much smaller crowd. So we'll see.
But Dr. Anne, a pretty reasonable question from patients at some point is, hey, Moz and Anne, you guys keep telling the world how bloody switched on you are and you're super slick skin cancer doctors. Why can't you just pick up all my skin cancers without this total body photography?
That is such a great question, Dr. Moz. And I'm glad you asked it, because there is definitely an answer to that. So when we're baby skin cancer doctors, we learn all the features of melanoma and read all the textbooks. There are indeed melanoma-specific criteria. There are features when we look down our little skin microscope that if a lesion has a particular structure or arrangement of structures, this would be suggesting that it's a melanoma. And it's really helpful if a skin spot has some of those changes. But unfortunately, there's a definite subsection of melanomas that don't have any of these features. They're so-called bland melanomas. And for those ones, you can actually only pick them up because they're showing asymmetric growth. Yeah. But even when you go back and look at these things, once you've cut them out and you know they're a melanoma, and you look at the clinical picture and you look at the dermoscopy, the skin microscopy picture, there's still nothing there. None of the cardinal features. Very, very rude of some melanomas not to wave at us.
Absolutely. And I can think of a few of them where really the only difference has been that, the patient has noticed that the mole is changing. We've taken a photo of it, and then we saw it again 3 months later, and it continued to change in an unusual way. And then when we did a biopsy, we were all sort of floored that it was a melanoma. That is not an unheard of thing.
Yeah, and it's not news to us. Total body photography has been around since the 1990s, because we know that it's useful. And a sort of relatively recent study based in New South Wales, to be fair, of patients at high risk of melanoma, most of them had already had one. But in that population, in follow-up over a few years, fully 40% of the melanomas identified were identified by total body photography. Not by their clinical features, not by the skin microscopy features, but just because they were clearly changing or new on total body photography. So it's probably finding a whole new collection of melanomas that were just not getting picked up before.
Or we're probably going to be picked up at a later stage, which again, this is part of the conversation that we have all the time with our patients around why are you spending 40 minutes or 30 minutes on a skin check versus, I went and saw Dr. X or Dr. Y and they spent, 5 minutes or 10 minutes. And it's often because we're trying to find these teeny tiny little things, because ultimately if you find it earlier, you are probably going to have a better outcome. And so it's not that the melanoma would have been impossible to find forever and ever and ever. Eventually it would have declared itself. But if we can find it earlier on in the piece, hopefully the patients can have better outcomes.
Absolutely, because we talked about in previous podcasts, your prognosis, the whether you live or die from your melanoma, depends completely on its thickness at the point where we diagnose it. So, yeah.
Yeah, absolutely. So you mentioned that it used to be, that total body photography sort of began in the 1990s. So obviously we've just announced that Yarra Trail Medical has bought a Vectra 360. They weren't using Vectra 360s in the 1990s. What did it sort of look like back then?
So back then you saw a medical photographer. You would strike a number, usually at least 4 different poses where you could turn, and you would end up with a collection of large glossy photographs in a big package that you would have to carry around with you when you were seeing your skin doctor. And I actually have done it, a couple of these, certainly earlier on when I started. I don't know if you've had patients come in with their total body photographs from 10 years or more ago. And literally as you're looking at the patient, you have to find the relevant picture and compare, manually compare from the patient to the picture, and then find the next relevant picture. So it was definitely doable and useful, but cumbersome and very time inefficient, which translates to cost inefficient for the patient as well. That if we have to take an hour to do that, then unfortunately that hour has to be paid for. Yeah.
I actually really almost appreciate the organizational skills required to still have that, this far on or whatever the case is, because nobody's done that for some time. Well, actually, maybe not nobody's done that. It hasn't been mainstream practice for some time. And, I'll still see patients coming in and they've got, the folder with the
The
I don't know what the
pictures.
folder's called,
Yeah.
but the pictures are sort of sitting in through there. And you got, like you said, you got to carefully whip them out, and you sort of, oh, what does this person look like, and oh, what does that mole look like? It is a blast from the past.
It is indeed. So really from about the 2010s, it's been electronic images. And the Australian guidelines do recognise the role of total body photography. Our current guidelines for the management of melanoma actually goes as far as to say that total body photography should be the primary imaging intervention for early melanoma detection for patients at elevated risk who've got lots of moles or have got lots of funny looking moles. So that's one recommendation. And in terms of using total body photography to screen the population, it's currently a very conservative recommendation, but it says that people at very high risk of melanoma, which is by their definition less than 1% of the population, they should have total body photography every 6 months, which is quite frequent. But that's probably potentially about to change because we've got the National Targeted Skin Cancer Screening Programme likely to roll out sometime in the next 2 or 3 years, as far as I'm aware.
Currently working on that, yeah, absolutely. So the Melanoma Institute of Australia, along with a couple of other key stakeholders, are all sort of sitting and thinking very hard about what skin cancer screening in Australia should look like.
Yeah, and they will work out who should have screening, which I'm assuming is going to be more than the 1% of the population that are at very high risk. Won't be everyone. No. But anyway, they will work out their criteria, which I think will be a little more generous. And the sort of smart money. One of the suggestions, it's not definitely what's going to happen, but this there's a fair chance that one of these Vectra WB360s, one of the machines that Yarra Trail Medical are about to install, will be the bedrock, the foundation of the skin cancer screening program. That they're going to use this technology because it is so amazingly good. So, and of course, it comes back to the recommendations in the melanoma guidelines are about cost effectiveness. They're not about whether it is useful for a specific individual to have total body photography. It's about whether it's cost effective, whether it's a good spend of federal health dollars.
Yeah. And we've talked lots about that in lots of different settings. You know, what makes sense at a population level may not always be what is useful for the individual. You know, if someone has the means to get, you know, the additional meningitis B vaccine for their child, that's probably a measure that we'd recommend. Similarly, you know, if you're going to Vectra 360 every Australian from birth until the grave, you're going to see a tremendous churn of tax dollars. And so you've got to work out who to judiciously use that on. But if money was not an object and resources were not an object, there probably wouldn't be any harm in every person who has skin, essentially, once they sort of
should reach have it,
you know, getting their skin checked,
From a sort of person in charge of the health dollar spend point of view, the decision they have to make is it cheaper to find your melanoma earlier using the TBP or to catch you later? You know, will the cost of treating you at a later stage be less than the cost of finding? So that their decision is very different from the individual's decision. So of course, the total body photography is not going to be funded at any level by Medicare, by government. So it's an individual decision whether it's something you feel is a good use of your money to look after your own health. Yeah.
And I think just, you know, I guess the asterisk on that is that there will be people out there listening to this who say, you know, my dog groomer's best friend's niece gets her body skin checked annually by the Alfred's Melanoma Institute. The reality is, if you have made enough melanomas and you are high risk enough and known enough to whichever your state's melanoma service is, a lot of them have these Vectras now. So I think in Victoria, I think there's 5. It's the Peter Mac, the Alfred's Melanoma Unit, Skin and Health Institute, and I think there's a couple of others. But you know, if there is funding available to you, it'll probably be because you've already had a bunch of melanomas and the researchers are very interested to you and you know them very well. If you have no idea what we're talking about, then there's probably no funding for you.
And just in case there's any confusion, the Vectra WB360 is the official name by Canfield to make the 3D total body photography machine. At Yarra Trail Medical, the management team have called their own specific machine, the Skin Check 360. It's just the in-house name for it. So when we say Skin Check 360, when we say Vectra, when we say WB360, we're referring every time to the same thing.
Yeah, that's right. Thank you, Dr. Anne.
Okay, so I guess we should talk a little about what's special about the machine that's going to be installed at Yarra Trail Medical, because if anyone's had a look, some of the comments on social media have been, to be fair, not from our patients, but from other interested people in the community, have been that it seems expensive. Would you like to comment on that, Dr. Moz?
So I guess we'll provide some context. So we talked about the glossy photos and we sort of moved straight to the 360. There's definitely been some iterations in between. And so, there's a wide variety of approaches that people will use to try and take total body photography. As a general rule in 2025, it falls into kind of two things. Someone with an iPhone or an iPad and a connected device that is trying to take images of you in a similar pose. And so the accuracy of those photos will rely on the same phone being used in roughly the same lighting, in roughly the same position. If the photo's blurry or if the photo's out of focus or if the photo's whatever, then you just don't have a photo for that year or whatever the case may be. Or the second option is some version of fancy tower that is motorized and has some camera attached to it, an SLR camera usually that's attached to it. And again, if there's issues with the flash or with the focus or with the lighting or whatever, then you end up having an inconsistent photo. And it might seem really nitpicky, but, we've used, that sort of tower setup previously, Dr. Anne, and it really can be quite iffy if the staff haven't done a perfect job of lining the patient up, a perfect job of replicating the lighting, a perfect job of replicating the camera settings. It can almost be to the point of where it's really difficult to actually make heads or tails of whether the color change in a mole between one year to the next is because of a camera setting or because of a lighting setting, or if the mole has really changed. And so it becomes sort of really difficult to rely on that above and beyond your own clinical expertise. What the Vectra does really differently is you walk in there and it captures, I think, what's the number, Dr. Anne? It's how many photos?
92 cameras take a picture at the same time. So it's a single capture of 92 pictures that take a picture of all your surfaces, and then the system knits all those images together to actually produce a three-dimensional avatar of you, showing it. Not quite all your skin surface, cover that, but all of your skin surfaces that are visible to it, which means there aren't any bits missed, because as well as the lighting and the camera angle making it difficult in the older technology to know if a mole has changed color. If you're rotated slightly in the second picture compared to the first picture with the 2D technology, it can miss some spots altogether, and certainly the machine reader cannot map one spot to the other if your position is exactly the same. Humans can, but that comes back to the really labor and time intensive things. So.
And that's not that rare an event. When we were working with the tower style total body photography, it wouldn't be unusual for a mole to, not even in that interesting a spot, if the elbow's been cut off, the midsection photo hasn't gone up as high as the elbow, and then the setting on the top section photo didn't go down as low as the elbow, then you've got a section of elbow that's missing. And so when we're doing the skin check, you're then taking a photo of the elbow with a very different camera in very different lighting in a very different setting. And then next year's photo looks different again. So there's a lot of manual. And again, is that the end of the world? It's not the end of the world. You're still getting an excellent skin check. At the end of the day, the key thing is
still much better than
clinician.
not having total body photography. But
100%.
The issue is you end up you've done the back of you, the side of you, the front of you, and the other side of you. So it produces 4 sets of flat pictures. But the reality is, human beings most of us are not a cuboid shape. Most of us are somewhat curvy, some of us more than others. So producing a series of flat photographs doesn't work terribly well for the human body. It's definitely possible for some areas to be missed, however hard you try. So the fact that the Vectra produces the 3-dimensional wraparound picture of your skin means that very little is missed. But we should probably talk about what isn't seen on the Vectra scan.
Yeah, so there's a couple of spots obviously that aren't going to be seen. So people who've had a skin check by us will know that we check the bottoms of the feet, we'll check in between the toes, we'll check in between the fingers. You probably aren't going to get great photos of those locations. People will also know that we check the scalp and that we check the inside of the mouth and the eyelids. And so again, those areas, you know,
they're not shown well. So basically you're standing for the Vectra picture. So the soles of your feet are not imaged at all because you're standing on them. Any areas that are covered by clothes will not be imaged. So on that note, we would encourage you to wear relatively skimpy undies. It's entirely your choice what you wear, but understand that anything that is covered, you've not got a record of what's there. So again, for people who it's relevant to, we would encourage you to take your bra off if you can at all feel comfortable. The room will be very private. It will be a trained healthcare technician who's doing it. Much the same for when we go for mammograms, the bra has to come off. It's a waste of time otherwise. So I wouldn't quite say it's a waste of time, but understand, please, that anything that's covered up, it's not getting a check. It's not getting mapped. And unless you're bald, your scalp's not getting covered as either. And as Mo said, between the fingers, between the toes, not getting seen well at all. But we're still getting, I would be guessing, more than 90% of the body surface mapped. So still really, really, really meaningful.
Yeah, absolutely. And so we touched on this before. You walk in, you get this magnificent, set of images, and then a computer gets involved. So how does the computer get involved, Dr. Anne?
So yes, it's really interesting. Although we said that probably your second and subsequent total body photography is when you really start to get interesting information. That's not quite true, because even with the baseline one, there's some interesting AI that we can use to help us interrogate the data that's available to the machine. So even with your baseline images, we can ask it to show us spots that are above a certain size, say above 5 millimeters in size. We can ask the machine to show us spots that have some pink or red in them, which can be a sign of increased blood supply and can be concerning. We can ask it to show us spots that are irregular in shape or irregular in colour. So it doesn't make the diagnosis, but it can help draw. It says as a double check for us. We can have done our check and then say to the machine, hey, show me all the ones that were irregular above a certain size. And it's just a second check. So it's great tech. Yeah.
Absolutely. And again, I'm sure that, I don't know what your consult room looks like, but my consult room chat over the last, 18, 24 months has been filled with, when's AI coming to replace you? And I think the reality is anyone who's actually played with any of this sort of artificial intelligence knows that it's not actually probably going to replace us. It's the people who don't use it will probably be the ones that are sort of left behind. And I think, like you said, it's an augmentation. It really does improve your ability to perform your job. But, we've had AI in the skin cancer software for several years now, and it certainly doesn't replace us. Like, it is missing skin cancers that we are picking, and it is calling things skin cancers that are clearly not skin cancers. So it is a really useful thing to be able to interrogate and sort of say, what have I missed? But it certainly doesn't replace someone who's well trained.
It doesn't, but it's exciting, and it can only get better in the future. And anything that helps pick up more cancers is great.
Absolutely.
The one other nice little thing that this offers, my understanding is that Yara Trail Medical plans to give all patients who have the 3D total body photography scan to give you a copy of your own images to refer to at home, which means that when you're doing your own self-skin check, which of course everyone is doing every 3 months, as recommended by the Australasian College of Dermatologists, then you
and
can
of course by
us
in our series around skin cancer, Dr. Anne.
Absolutely, recommended by us as well. But no, on a more serious note, if you're looking at your skin, you think, is that spot new? If you've had total body photography, you can just put in your, click on, I think it's actually going to be sent as a link to the patients with access. I'm not quite sure how that because that's not our bit, because it's not actually a service provided by us, but I understand that you will have access to your pictures and you will be able to access your pictures, look at that bit of your skin, and you will know for sure whether the spot is pre-existing or not. And indeed, you'll even to be make a slight judgment on whether it is changing or not. Although, of course, if it's changing, you then have to come and see us. Like that's your bit done. Thank you for your help. Time to come and see the professional. But yeah, that's a really exciting development, because people monitoring their own skin in the same way that people who have breasts are asked to monitor their own breasts, that is actually an important thing that we should all be doing.
Yeah. And I think one probably really important thing which you've touched on there, the reason that we're not clear on whether it's going to be a USB or a CD or a digital link, is essentially the service is not actually provided by you and I. So, and also number one, that small detail may actually change over time. So what might start out as a link might end up being a USB and so on and so forth. But the reality is, this is a service that's going to be offered by Yarra Trail Medical. And we've actually decided as, independent people working at Yarra Trail Medical, that we would really like as many of our patients to be able to access this as practically possible. We've actually reduced our skin check fees for people who are going to get a Vectra. So, take home dollars for Dr. Anne and Dr. Moz is less if you get a Vectra compared to if you're not. And so, very definitely we want people to understand that it is Yarra Trail that runs the Vectra. We run the skin cancer, check service. And essentially we think what Yarra Trail is doing is so magnificent that we would really like everybody to be able to afford to do that. And as such, we've actually reduced our skin check fee.
Yeah, we've shaved a fair bit off. So if you're having a skin checked in association with a Yarra Trail Medical Vectra total body scan, we've reduced our fee quite significantly. So, and there's nothing in it financially for us for you having a total body photography scan. Quite correctly, what you'll pay for the scan goes to Yarra Trail Medical, because it's their kit and their investment, their service.
And not insignificant investment either.
A very, very significant investment. Yeah. But again, they're, as us, interested in the health of the local community. So, we think it's a great piece of kit. We're super excited that it's going to be co-located with us at Yarra Trail Medical in Briar Hill. We are happy to, at least in the early months, to offer a reduced price skin check in association with it, because we think it's a really good thing for you guys to have. But I suppose the other thing to say, that if for whatever reason you just don't want to do total body photography, we are still very, very happy to continue seeing you, as we always have done, doing a manual top to toe skin check or spot check. So it's not an either or. We think it's complementary to the skin check, but ultimately you get to decide what sort of check you have and how you spend your dollars.
Absolutely. And I think one of the things that probably we haven't specifically touched on, but might be sort of, floating in the wilderness, is I think this is only one of two machines in Melbourne that any random person can decide they would like to engage with. Because whilst I think there are 6 machines in Melbourne, 4 of those 6, you must essentially be a high-risk melanoma person who has already had a bunch of melanomas and be part of either a trial or have, a dermatologist or a Mohs surgeon or a plastic surgeon who has decided that you are extremely high risk. This machine, and then there's a machine Bayside, where basically they're the only 2 machines where you can pick up the phone and say, I would like to actually have a Vectra for myself. I am concerned. I've got a family history. I have 347 moles. I'm very worried about that. Or I've had a bunch of basal and squamous cell cancers and no melanomas. I'm worried about missing my melanoma. I think that's one of the other advantages that we have over the other machines that are in Melbourne.
Although, to be absolutely clear, patients won't be able to book in just for the 3D total body photography scan, because, as we said right back at the beginning, it's not a standalone skin check. So the booking will have to be partnered with a booking for a skin check at Yarra Trail, or patients, if they already have somebody else that they're seeing for their skin checks, then that skin cancer practitioner can refer them to Yarra Trail to have the total body photography.
Yeah, absolutely.
You can't book just for the scan.
Yeah, that's right. So someone needs to take responsibility for those images. It would be like walking into an X-ray place and no doctor looking at the X-ray. So if you have a
Yep.
great skin cancer doctor that you already have an existing relationship with, your skin cancer doctor can actually refer you to the team at Yarra Trail Medical, get a Vectra, and then be able to look at those images year on year. And you can rely on the expertise of your skin cancer doctor to interpret those images, which again is a service to the community that we think is really valuable. So I think that
Mm.
these very exciting times, I think, at Yarra Trail.
Yep.
Oh, I think we've covered quite a bit today.
I think so.
I don't know what the costs are off the top of my head. I don't know if we've covered costs. I think they're on the
They're on
website.
Yarra Trail
Yeah.
Medical's website. I think it's probably the best place to go because, I say, it's all just been rolled out just now, and I wouldn't like to speak for Yarra Trail.
The risk is that if we say a number and then it's changed in 2 weeks or 3 weeks, then
Yes,
this
yeah.
becomes obsolete.
See,
So
once again, the pricing of that is not under our control. It's not our system. The fees charged for that don't come to us. But make no mistake, we are very excited. This is going to be located at the premises we work from, and really hoping that a lot of our patients will take advantage of it because it's almost certainly going to translate to better outcomes for them.
absolutely.
Okay.
Well, thank you very much for making it this far in. If you have found the podcast helpful, I think this is a great one to share, especially locally, and if you're close enough to the Yarra Trail Clinic to be able to access the service. If you haven't already, track us down on the socials. We're on Instagram, Facebook. There's now a YouTube channel as well. It's rocking and rolling. And if you have any questions, find us on the socials or via email. We're both very happy, and all our contact details downstairs. Remember to give the podcast a 5-star rating on Apple Music and Spotify, and make sure you hit that like and subscribe button on the old YouTube as well to help the podcast spread to more ears. Thank you very much for your time, Dr. Anne. Appreciate it.
Thank you for yours, Dr. Moz. See you next time.
Ciao.
Bye.